Welcome to the Endo Kids podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsay Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Welcome back to the Endo Kids podcast, where little hormones meet big answers. Today's episode is one we intentionally are slowing down and expanding upon. This is a deep, thoughtful conversation for parents who want to truly understand type 1 diabetes, not just survive the diagnosis. If your child was recently diagnosed, you may feel like your world shifted overnight and you're suddenly learning a new language. Blood sugars, insulin, alarms, ratios, highs, lows. Today, we want to slow down and walk with you through what type 1 diabetes really is, how it's treated, and what daily life looks like long term.
Absolutely. This episode is designed to be one you can come back to. There's really no rush. Type 1 diabetes is serious, but it's also very manageable. Children with type 1 diabetes grow into adults with full, meaningful, independent lives, and we want you to understand why that's true.
So let's start with what type 1 diabetes is. Type 1 diabetes is an autoimmune disease. That means the immune system, whose job it is to protect us, mistakenly attacks the insulin-producing beta cells in the pancreas.
If you've heard any of our other episodes, we've talked about autoimmune conditions, like in the thyroid, and that's the same thing that's happening here. The hormone that's affected is insulin, and that's a hormone that allows glucose or sugar to move from the bloodstream into the body cells to be used for energy. Without insulin, sugar builds up in the blood, but the body's cells are actually starving.
And this is where the confusion happens. Parents often hear the word diabetes and think about food or weight. Welcome to the Endo Kids podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsay Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. Type 1 diabetes has nothing to do with what you're eating, sugar intake, body sizes, or parenting choices.
And I think that's something that we should definitely stress. Again, when many people hear the word diabetes, they automatically think about what we talk about as type 2 diabetes. And we're going to talk about that in a later episode. But type 1 diabetes is very different. And again, it has nothing to do with what you're eating, how you're exercising, your body size, just like Dr. Mehra just said. This process, type 1 diabetes, can happen silently over months or even years. By the time that symptoms appear, most of the insulin-producing cells have already been damaged.
Again, to emphasize, there's nothing that you did to cause this and nothing you could have done to prevent it.
I know that when I tell families that exact phrase, I can't tell if it's a little bit more frustrating for them or if it's something that makes them feel better. But it is really true. There's nothing that a parent or a family did to cause type 1 diabetes. And there's really nothing they could have done right now that could have totally prevented it. Let's move on to what symptoms look like. The classic symptoms of type 1 diabetes include excessive thirst, frequent urination, weight loss, fatigue, and mood changes. And when we talk about that thirst, it is drinking bottles and bottles of water, something that's very different from the past. And the urination as well, having to pee all the time, waking up in the middle of the night to pee on a consistent basis. It's not the once in a while waking up in the middle of the night or one day is a little bit more thirsty than the other. It's really a shudder that families describe.
And so sometimes the diagnosis I feel like is slow to discover, I would say, because kids are playing sports and sometimes it's summertime and they're drinking a lot of water and they're going to the bathroom a lot and they're tired. And so the symptoms come on sometimes subtly and parents don't really recognize what's happening. But high blood sugar does pull water out of the body. And that's why kids are constantly thirsty and urinating. And then because their cells can't access sugar for energy, kids feel tired and weak and they lose weight despite eating more. And one of the other symptoms is that they're always hungry. So we see that quite a bit. So if you're worried about some of those symptoms, it's really important to see your pediatrician right away because some of those could be normal as part of sports and activity. But if you're noticing, like Dr. Waldman said, getting up in the middle of the night to pee in a child who otherwise was potty trained or not getting up, really important to get that evaluated.
Absolutely. And like we said, the symptoms usually take sort of a slow onset, but then can progress very quickly, which is why many children are diagnosed suddenly. Again, there are some families that describe all of a sudden, the past 2 to 3 days, my child is very thirsty and peeing all the time. And then there are other families who say they've been noticing it for a few months and then suddenly things progress.
Yeah. And the other thing I wanted to comment on is the age of diagnosis. So, really, we see type 1 diabetes in all ages in children. Dr. Waldman, what's the youngest age that you ever saw a child with type 1 diabetes?
I've had 2-year-olds for sure. I'm not sure if I've had less than two, but absolutely, I've had a good handful of 2-year-olds being diagnosed with type 1. What about you?
Yeah, I think I've had two is probably my youngest that I've seen with type 1 diabetes. I also have seen a lot of adolescents who are diagnosed, and a lot of times it's because of the hormonal shifts that happen during adolescence, and that's when we see type 1 diabetes. But the diagnosis usually happens actually in the pediatrician's office, where you take your child to the pediatrician's office and they say, hey, my child is drinking a little bit more and peeing a little bit more, and the pediatrician will do a urine test, and sometimes we'll see glucose or sugar in the urine. Sometimes the child ends up in the emergency room because they're so dehydrated or in the hospital, and sometimes it's pretty scary. But often I have seen kids who are just diagnosed at the pediatrician's office with drinking a lot and peeing a lot, and the pediatrician will say, hey, we did a sugar in the office or we did a urine test and the blood sugar was high, and that's how the diagnosis occurs.
Absolutely. And once that diagnosis happens, you are very likely to meet a pediatric endocrinologist, like both of us are, and to receive tons and tons of education about what type 1 diabetes is and how to treat it. During that education, you are introduced to what is insulin, how to check blood sugars, what we call carbohydrate counting, and technology all at once. There's a lot of diabetes technology that's out there now. We want to normalize this. The first few weeks are super overwhelming for everyone. Maybe I should even say the first few months. It is a big diagnosis and lots of changes are made, but we have lots of faith that education that you will receive will be amazing and you will be able to treat your child with type 1.
And really, you're not expected to be perfect. I think people think that when they leave the hospital or they leave that education from the hospital centers or the pediatric endocrinologist office, that they're expected to be perfect. And you're not. You're expected to learn gradually. And the pediatric endocrinologists usually are available on call. The nursing staff usually is available on call in the major hospital centers to answer your questions. Make sure that you're aware of that as well. The treatment for diabetes is insulin. So type 1 diabetes treatment is lifelong insulin replacement. And again, insulin is not the medication we're using to lower the sugar. I mean, it is, but it is a hormone that the body is no longer making. And that's why your child needs it. So I have had a lot of people ask, like, why does my child need insulin forever? And it's really because your body's not making insulin anymore. And so we need to replace it. So very important to understand that. And again, this is very different from type 2, which we'll talk about later. It's your body's not making insulin. Your child needs that insulin to survive and to live.
Absolutely. That's how I describe it as well. We are giving back what the body is not making. We're not trying to give extra. We're not trying to give less. We're just trying to give what the body should be making. The way we think about insulin is in two ways: basal insulin and bolus insulin. Basal insulin is that background insulin that's needed all day, all night, 24 hours a day. It's needed in the background to keep blood sugars nice and steady. And the bolus insulin, also called, sometimes we think of it as shorter acting insulin, is given for meals and to correct high blood sugars. So many times, patients will take one insulin injection for the basal insulin, and then three or more, depending on their blood sugars and their meal times, as the bolus insulin.
Yeah. And our goal really, again, is to mimic what the pancreas is doing. So our pancreas functions beautifully to lower our blood sugars when we eat. When we eat anything with carbohydrates, for example, insulin in our body rises and then it falls. And we're really trying to mimic that. We're not trying to achieve perfect numbers because we're not the pancreas, but we're trying to mimic exactly what the pancreas does to lower the blood sugars and keep the blood sugars within a safe range.
And insulin can be given through two different ways. One is through injections, and the other is through an insulin pump. So, like I mentioned before, if you're on injections, you're usually taking multiple a day, usually at least 4. And if you're on an insulin pump, so that's something that you wear on the body, it stays on the body, and you change that infusion site every few days.
Yeah, and the insulin pump delivers small amounts of rapid acting insulin continuously and allows for some flexibility during sports, illness, and growth spurts. But you can achieve some of that also with an injection. So don't feel like your child has to be on an insulin pump. Traditionally, when I was in training, we would never put someone on an insulin pump first. We would actually start them on injections first, so the patients and the parents learned how to do the injections in case the pump failed. And I think it's a good idea to understand how injections are given, to learn how to calculate doses for families, because the pump is a great technology, but it is just that, technology. And sometimes technology fails. And so I think the trend has been for more of us to start our patients on pumps faster and earlier because of the new technology that's out. But I think it's important to understand that you don't have to be on a pump. And if you are on a pump, really important to understand how the injections work too.
Absolutely. Like you said, there's no single right choice for anyone. Every family chooses what approach works best for them, and things change over time. So you might want to be on injections for a little bit and then change to a pump. Maybe you want to go back to injections, vice versa. Things change and technology changes. We know that in the past few years, the pumps have gotten better and easier to use. So all of this is really exciting when we think about treating diabetes.
And the other thing I wanted to comment on is continuous glucose monitors, because I get a lot of questions about that. And to be honest, there's a lot of people using it now who don't have diabetes, but patients with type 1 diabetes have been using continuous glucose monitors for many years, and they have really transformed diabetes care. When I started my training, really patients were pricking their finger or 6, 8, 10 times a day, measuring blood sugars overnight by pricking their finger with glucometers. CGMs have transformed diabetes care in that you're wearing a small device that measures blood glucose every few minutes and really shows the trends over time, and really has revolutionized the way diabetes is managed, I would say.
Absolutely. The very cool thing is not only do you see where your blood sugar is right now, but you're able to see the trend. Where is it going? Is it going high really quickly? Is it staying nice and stable? And this way, CGMs, continuous glucose monitors, really improve safety, especially overnight in our pediatric population.
Yes, and I've had a lot of patients who have had low blood sugars or hypoglycemia and no way of knowing until they had the CGM, which could show them the trends that their blood sugars are starting to go low. And I think it's very important to understand, though, that CGMs are tools and they're not guarantees. So the CGMs also can fail, they can not work properly. So they do provide information, but they're not perfect at all by any means.
And one of the very, very most exciting things is now our insulin pumps work with those continuous glucose monitors. So they can automatically adjust what is going on with the insulin. If the continuous glucose monitor looks like it's going up, the pump will turn. And if it looks like the blood sugar is going down, the pump will turn down or even turn off.
Yeah, and these systems really reduce overnight lows and help improve the time and range, but they still sometimes require human decision making, extra boluses. So, really important to understand that the technology is available, but still requires human guidance.
Absolutely.
I want to talk next about low blood sugars and hypoglycemia. So, hypoglycemia or low blood sugar is one of the scariest part for parents, or it has been. And I just want to talk about that a little bit.
Yes. Low blood sugars happen when there's too much insulin in the body, too much that than the body needs. Symptoms of hypoglycemia can include shakiness, sweating, irritability, confusion, or even sleepiness.
And mild lows are common and treatable. So we do teach patients and parents what does it mean to have a low blood sugar? What is that number? What are the symptoms? And really important to be able to recognize some of those symptoms. Severe lows can happen too, and they do require planning and education. They may be more rare, but it depends on the patient again. Some patients may be scared of highs and give themselves a little bit too much insulin, and then we see a little bit some more severe lows. So very important to understand though that low blood sugars are also can be dangerous and sometimes can lead to more complications. So really important to understand what they are and how to treat them.
Yes. And also how to recognize the symptoms. So, both the patient understanding how their body feels when they're starting to go low, and families learning what the signs are in their family member and how to recognize that. Most of the time, treating a low blood sugar is just with quick, fast acting carbohydrates, a mini juice box, a squeezy applesauce. Those are ones I always talk to people about having in their backpacks or their bags with them, and also learning how to prevent them in the future. So when you see a low, yes, you want to treat it, fix it, get that number back up. And then afterwards, think about, why did that happen? Sometimes you can figure out, oh, you know what? I gave myself a little too much insulin with the meal, or I exercised and didn't have a snack before. And then there are definitely some instances where you rack your brain and you just cannot come up with a reason.
Yeah, and really the goal is not zero lows. The goal is safety and preparation. So, like Dr. Waldman said, I think it's very important to have something in the backpack or your purse or with the child if they're going away or staying over at a friend's house to help treat low blood sugars. Okay, so super important to have that available because not everybody will have that available. I mean, if you're traveling, really important to have that available. Diabetes management really is not about perfect numbers, though. So I want to stress that. Blood sugars change over time with growth. They change in puberty. They change with illness. They change with stress, with hormones and sleep. And I think I have a poster in the office that shows like 46 ways that your blood sugars can change depending on different factors in your life. So, really important to understand that diabetes management is not about perfect numbers and that we are trying to mimic what the pancreas does.
Absolutely. And it's really looking about patterns over time and not one single reading. So we focus on safety, growth, and especially quality of life. That is so important. We want our patients, the children that we treat, to be able to live their lives and do all of the things that they want to do: go to school, play sports, participate in family functions, and not always to be worrying about their blood sugar.
Yeah, and I want to take a few minutes to talk about that because this is our introductory episode to type 1 diabetes, and we have a lot of other things to say about type 1. But the type 1 diabetes requires attention every day. And type 1 diabetes really can lead to some burnout in some patients. And mental health is really important, either at diagnosis or any time between the initial diagnosis and throughout the child's life, and even for parents also. So it's very important that we recognize that as well.
Absolutely. And working with a team is also really important. Yes, your pediatric endocrinologist is an important person on the team to help teach and guide what to do. But having a mental health professional on the team is also really important because, just like Dr. Mara said, we know that burnout is real. Having those blood sugars come to you all day, constantly, it's almost like feeling like you get a grade all the time. And if you're not getting an A all the time, that can take a toll on you for sure.
Yeah. And again, really important to understand that we don't need perfection. And parents often worry about independence for the child and college and adulthood and long term health. And we know that with modern care, our children's diagnoses have dramatically improved and we have much better outcomes than before.
Absolutely. With the technology that we have now, kids are turning into amazing, healthy young adults and adults living with type 1 diabetes. It is amazing what they're doing. They are playing professional sports. They are in every industry you can think of. So, yes, this is a huge obstacle, but absolutely one that it can be managed at all ages.
Yes, and type 1 diabetes changes routines, so it does not change your child's potential by any means.
And we want you to know that you're not alone. You did not cause this, and your child's future is still wide open. Thanks for listening to this episode of the Endo Kids podcast. Make sure to check your feed for future episodes. Thank you so much for joining us on the Endo Kids podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.